We present the surgical technique of all-inside bone patellar bone anterior cruciate ligament reconstruction. These are our disclosures. For this procedure, standard bone patellar tendon bone equipment is used, along with BTV tightrope for the femur and FiberTech tightropes with ABS button for the tibia. The most important part of this procedure is to review the patella length on preoperative MRI and the patient's height. One can then consider if all-inside BTB is possible, which is in our experience in all cases without patella alta. The patient in the video is 6 foot 2 inches and we will prepare a 72 millimeter long graft. Standard bone patellar tendon bone harvesting technique is used for a 30 millimeter long and 10 millimeter wide patellar bone block. No mallet should be used in the patella to avoid fracture. The shorter bone block decreases the risk of fracture and makes passing into the tibial tunnel easier. The tibial bone block is then cut with 10 millimeter width and 50 millimeter length, and the adhesions are released. On the back table, the tendon length and total graft length are confirmed, and final decision for all-inside reconstruction is made. With an aimed total graft length of 72 millimeters and a harvested tendon length of 50 millimeters, the tibial bone block is shortened to 12 millimeters, according to the OSU graft metrics table. After standard preparation, 1 hole is drilled in the tibial bone block and 2 holes in the femoral bone block, of which one in the proximal third and the other close to the tendon. A rescue stitch is placed through the distal hole of the femoral end, and a standard tightrope is connected to the proximal hole. The tibial side is prepared similar to quadriceps tendon graft using the FiberTech tightrope. Because of the smaller bone block, this provides extra security to the graft. The clamp is placed in a drilled hole, and sutures are first passed through the tendon and then also through the drilled hole. The end result is shown. During arthroscopy, the torn ACL with empty notch is confirmed, the ACL remnant is debrided, and a small notchplasty is performed. Using a curette, an indentation is made at the deep and high position of the femoral wall. The guide is placed within the indentation and the femoral tunnel is drilled using a retrograde drill. The final deep and high tunnel position can be seen from the anteromedial portal with only 1 millimeter of back wall. Using standard landmarks, a 10.5 millimeter tunnel is drilled from the joint to the hub of the retrograde. A suture passer retrieves both sutures from interarticular at the same time to avoid a tissue bridge. The medial portal is extended and the femoral shuttle suture is used to introduce the graft into the joint. The graft is pulled back to flip the button on the cortex, and this is confirmed by palpation. The femoral bone block is shuttled into the femoral tunnel by shortening the wide sutures. The graft is then pulled into the tibial tunnel using the tibial shuttle suture. Good tension of the graft is obtained without graft tunnel mismatch, and there is no impingement. Final tension after fixation is shown with a probe. The ABS button is loaded on the wide shuttle sutures, and the adjustable loop is shortened to provide final tension of the ACL graft. Thank you for your attention.